Script. High blood pressure is one of those problems that people almost always blame on the usual suspects. They blame salt, stress, aging, weight gain, or family history. And yes, all of those things can matter, but sometimes the real reason your blood pressure is climbing has been sitting quietly in your bathroom cabinet or on your kitchen counter the whole time. It can be a pill you take for pain, for congestion, for mood, for inflammation, or even for something that seems completely unrelated to the heart. And that's what makes this so easy to miss, because the medicine often feels normal, familiar, and harmless. So in this video, I want to walk you through 9 very common drugs and drug categories that can raise blood pressure or make blood pressure harder to control. And more importantly, I want to show you how to recognize the pattern, because in real life, this doesn't usually announce itself in an obvious way. It often looks more like this. Your readings slowly start creeping up, your blood pressure medicine doesn't seem to work as well as it used to, or your doctor keeps increasing doses without anyone stepping back to ask one very simple question. Could one of your medications be part of the problem? Before we start, please subscribe to the channel so you don't miss simple, research-based videos that help protect your health. And if you're new here, I'm Jessica Morgan. On this channel, I focus on helping you better understand the science of healthy aging in a way that is practical, clear, and actually usable in daily life. The goal is not just to throw studies or medical terms at you. The goal is to help you ask better questions, notice important patterns sooner, and feel more confident when you talk with your doctor about your health. Because when it comes to blood pressure, the number itself matters, yes, but understanding why that number changed often matters just as much. And one important note before we get into the list: this video is educational, and it is not personal medical advice. Please do not stop any prescription medication on your own just because you hear it mentioned here. That is especially important for things like steroids, antidepressants, stimulants, and psychiatric medications, where stopping suddenly can create The right move is not panic. The right move is to recognize a possible connection, track your readings carefully, and then bring that information to the clinician who prescribed the medication or the clinician who manages your blood pressure. Now, the reason this gets missed so often is because medication-related high blood pressure usually doesn't feel dramatic. It doesn't come with a flashing warning sign. It often shows up as resistant hypertension, which just means your pressure stays elevated even though you're trying to do everything right. Or it shows up after an otherwise routine medication change, or it appears seasonally, like when someone starts cold medicine in the winter and suddenly their blood pressure is 10 or 15 points higher than usual. If no one reviews the medication list carefully, it is very easy to assume the body changed when in fact the medication exposure changed first. And in general, drugs raise blood pressure through a few predictable pathways. Some make your blood vessels tighten, some make you retain salt and water, some speed up the heart or stimulate the nervous system, and some don't raise blood pressure directly so much as they interfere with the medications you're already taking to control it. Once you understand those pathways, the whole list starts to make more sense. So instead of memorizing random medications, I want you to think in patterns. And as we go through each one, I'll show you the kind of pattern that should make you suspicious. The first big category is pain relievers, especially NSAIDs. These are medicines like ibuprofen and naproxen, and they are probably some of the most commonly overlooked contributors to higher blood pressure. People take them for arthritis, knee pain, back pain, headaches, dental pain, or just the general wear and tear that comes with getting older. And because they're over the counter, they don't feel like a major medication. They feel casual. They feel temporary. But NSAIDs can make the kidneys hold on to more sodium and water, and they can also make some blood pressure medications work less effectively. That combination matters a lot, because if your body is retaining more fluid, the pressure inside the system goes up, and if the medications you rely on are being blunted at the same time, then blood pressure can drift up even faster. Now, not everyone will respond the same way. Someone who uses ibuprofen once in a while for a headache may see very little effect, but someone taking it most days for joint pain is a very different story. That's why one of the most useful questions to ask is not just, do you take ibuprofen? It's how often, how much, and for how long? And this is where people get tripped up. They'll say, but it's just Advil or it's just Aleve, as if over-the-counter automatically means blood pressure neutral. And it doesn't. In fact, chronic use is where the trouble tends to show up. So if your numbers have worsened over the last few months and you've also been taking more pain relievers because of shoulder pain, hip pain, or arthritis flares, that is a real clue. It doesn't mean you can never use these drugs. It means they deserve the same level of respect as prescription medications, especially if you already have hypertension or kidney issues. The second category is decongestants, and this one is a classic. Medicines like pseudoephedrine and phenylephrine are designed to open up your nose by shrinking blood vessels in the nasal passages. That's why they help you breathe better when you're stuffed up. But the problem is they don't only affect the nose. They can also tighten blood vessels elsewhere in the body, and that can push blood pressure upward. So the very mechanism that helps the congestion is also the mechanism that can create trouble for someone with hypertension, especially if that person's pressure is already borderline or poorly controlled. This becomes particularly sneaky during cold and flu season. Someone feels miserable. They grab a multi-symptom cold product, and they don't even realize there's a decongestant inside it. Then a few days later, their blood pressure is suddenly running high. They feel a bit wired. Maybe their heart is beating faster, and they assume it's just because they're sick. Sometimes it is the illness, but sometimes it's the medication. And in many cases, it's both. If you have high blood pressure, it is really worth reading labels closely, because the word cold medicine tells you almost nothing about what's actually inside the box. And the pattern here is usually pretty fast. If the culprit is a decongestant, the timing often lines up clearly. You were more stable, then you started taking the cold medication, and then the readings jumped. That's very different from the slow drift you might see with weight gain or aging. Also, if you have a history of uncontrolled blood pressure, these medications can be especially problematic. In that situation, safer alternatives may be things like saline rinses, nasal sprays recommended by your clinician, or non-decongestant symptom relief. The big point is not that every cold medicine is dangerous. It's that hidden ingredients matter. The third category is stimulant medications, including many drugs used for ADHD, alertness, and in some cases, appetite suppression or weight loss. These medications can increase blood pressure because they activate the sympathetic nervous system, the part of the system associated with alertness, focus, and the fight or flight response. That can raise heart rate, tighten blood vessels, and make the cardiovascular system run a little hotter. For some people, the increase is mild. For others, it is much more noticeable, especially if they already have hypertension, anxiety, sleep deprivation, or other factors that are already nudging the pressure in the wrong direction. One reason this gets overlooked is because when these medications help, they can help a lot. People feel more focused, more productive, more in control, and that benefit is very real. So naturally, the conversation centers around whether the medication improves attention or energy, not whether it quietly moved the blood pressure from acceptable to too high. That's why home readings become so useful. If a stimulant was added and around the same time your pressures began trending up, that's not something to ignore. It doesn't mean the medication is wrong for you. It means the cardiovascular side of the equation needs to be monitored too. And with stimulants, stacking effects matter even more than people realize. If you're on a stimulant, sleeping poorly, drinking a lot of caffeine, and taking a decongestant during allergy season, those effects can pile on top of each other. Each one alone may seem modest, but together they can create a much bigger push than expected. So when people say, I didn't change much, sometimes what they really mean is they didn't change one huge thing. But blood pressure often moves because several medium-sized things all lined up at once. That is a very common pattern in real-world hypertension. The fourth category is corticosteroids, medicines like prednisone or methylprednisolone. These are powerful anti-inflammatory drugs, and in the right situation, they can be incredibly helpful. They are used for asthma flares, autoimmune conditions, severe allergies, joint inflammation, skin disorders, and many other problems. But steroids can also raise blood pressure by promoting fluid retention, altering salt balance, and affecting the body's hormone signaling in ways that increase pressure. So if someone starts a steroid course and then notices swelling, higher readings, or that puffier, more fluid, heavy feeling, that's not something we should be surprised by. Now, sometimes the increase is temporary. especially with a short course. But not always. It depends on the dose, the duration, the person's baseline blood pressure, their kidney function, and how salt sensitive they are to begin with. This is why two people can take the same medication and have very different experiences. One person barely notices anything. Another person suddenly sees readings that are 15 or 20 points higher. And if you're already on the edge, even a temporary medication can push you into a range that deserves attention. The body doesn't really care whether the trigger is long-term if the pressure is high right now. Steroids are a good example of something I talk about a lot on this channel, which is that good medications can still have real trade-offs. If you need prednisone for a serious inflammatory flare, then yes, there may be a very good reason to use it. The answer is not automatically to avoid it. The answer is to go in with awareness. If you already have hypertension, that should be part of the plan from the beginning. You may need more frequent blood pressure checks, a closer eye on swelling, and a conversation about whether the lowest effective dose or a different route of treatment could reduce that blood pressure burden. The fifth category is antidepressants, especially certain ones that boost norepinephrine more strongly, like some SNRIs. This surprises a lot of people because they correctly think of antidepressants as brain medications, not blood pressure medications, but the brain and cardiovascular system are deeply connected. Some antidepressants can increase blood pressure by increasing activating neurotransmitters that also affect blood vessel tone and heart rate. Usually this is not dramatic, but sometimes it is clinically important, particularly at higher doses or in people who are already vulnerable. And that's why blood pressure should not disappear from the conversation when a mood medication is started. And I want to be especially careful here because this is a category where people can make dangerous decisions if they get scared. Depression and anxiety are real medical conditions. For many people, treatment is essential. So this is not a message to stop antidepressants. It's a message to monitor intelligently. If the medication clearly helps your mood, but your blood pressure has also drifted up, then that doesn't mean treatment failed. It means the treatment plan may need adjusting. Sometimes that means a dose change. Sometimes it means choosing a different medication. Sometimes it means treating the blood pressure more effectively. But it should be a thoughtful medical decision, not a sudden reaction. A clue that an antidepressant may be playing a role is that the timing fits. The blood pressure issue begins after the medication starts or after the dose is increased. Another clue is when people describe feeling a little more activated, a little more physically revved up, or having more palpitations while their readings are also climbing. Again, not everyone experiences this, but if you're someone who tracks your numbers at home, patterns like that can be incredibly valuable. A blood pressure log next to a medication change history often reveals connections that are completely invisible when people rely on memory alone. The sixth category is hormonal birth control and estrogen-containing hormone therapies. These medications can raise blood pressure in some people, and they are easy to miss because the conversation around them often focuses more on reproductive health, cycle control, or menopause symptoms. But hormones affect much more than that. Estrogen-related therapies can influence fluid balance, vascular tone, and hormone systems that regulate blood pressure. So if someone starts a pill, patch, or oral estrogen therapy, and then over time their readings rise, that deserves real attention. It may be subtle, it may happen gradually, but gradual changes count too. This is one of those areas where individual susceptibility matters a lot. Some people tolerate these medications beautifully from a blood pressure standpoint, and others do not. If there is already a history of hypertension, migraine with vascular risk, kidney disease, smoking, or other cardiovascular concerns, then the threshold for paying attention should be even lower. And again, the correct response is not to panic. The correct response is to connect the dots. A medication can be helpful and still require monitoring. Those two things are not contradictory. In medicine, they often go together. Benefits and trade-offs are almost always living in the same place. And because the changes can be slow, this category gets blamed on everything except the medication. People assume the rise was just age, stress, perimenopause, weight changes, or bad luck. Sometimes it is one of those things, but sometimes the timeline tells a cleaner story than people expect. So if a hormonal therapy was started in the last several months and your readings have steadily trended upward since then, it is worth bringing that possibility to your clinician directly. Not in an accusatory way, just in a clear, organized way. My blood pressure used to run here. I started this. Since then, it's been here. That is very useful information. The seventh category is atypical antipsychotic medications, such as drugs used for bipolar disorder, psychosis, and sometimes severe depression or behavioral symptoms. This is not a category everyone watching will personally take, but it's still important because these medications are common enough and their cardiovascular effects are often underappreciated. Some can raise blood pressure indirectly through weight gain, metabolic changes, insulin resistance, fluid shifts, or increased sympathetic activity. So even if the blood pressure effect is not always immediate, the longer-term impact on cardiometabolic health can be very significant in the right patient. This section also highlights something important about blood pressure in general, which is that not every medication raises it in the same way. Some push it up quickly, others create the conditions that make hypertension more likely over time. That distinction matters. If someone gains weight rapidly after starting a psychiatric medication, sleeps worse, becomes less active, and develops blood sugar problems while their pressure also rises, the blood pressure change may still be medication-related even if the mechanism is more indirect. That is why a thoughtful medication review looks not only at the reading itself, but also at what changed in the body after the treatment began. And just like with antidepressants, this is absolutely not a category to stop abruptly on your own. The mental health consequences of destabilizing these medications can be severe. But because these drugs are often taken long-term, they deserve long-term monitoring too. That means keeping an eye on blood pressure, weight, glucose, lipids, and overall cardiovascular risk. Sometimes the best move is to continue the medication because it is doing a job that really matters while addressing the metabolic side effects proactively. Again, this is why the right question is rarely, is this medicine good or bad? The right question is, what is it doing for this person, and what is it costing? The eighth category is caffeine-containing pills, energy products, and medication combinations with hidden stimulants. People often separate caffeine from real drugs, but when it's concentrated in pills, performance products, or symptom relief combinations, it absolutely belongs in this conversation. Caffeine can cause a short-term rise in blood pressure, especially in people who are not used to it or who are particularly sensitive to it. And because caffeine shows up in so many forms now, some people are getting much more than they realize. It's in headache formulas, alertness pills, workout products, and energy blends that are marketed more like lifestyle tools than physiologically active compounds. The reason this matters is not only the caffeine itself, but the context around it. If someone is tired because they're sleeping poorly, stressed, and already running borderline high blood pressure, then leaning on concentrated caffeine can become one more thing pushing the system upward. And unlike a stable morning cup of coffee, these products can be harder to dose consistently. The amount varies, the timing varies, and the stacking with other stimulants varies. So when someone says, I only take over-the-counter stuff, I really want to know what that means because a lot of over-the-counter products are more cardiovascularly active than people assume. A very practical test here is timing. If your blood pressure spikes after caffeine use, especially within about half an hour to an hour, that gives you a clue that you may be more sensitive than average. Not everyone is, but if you are, then concentrated forms may be worth rethinking. And if your numbers are already uncontrolled, this is one of the simpler things to experiment with under medical guidance. Sometimes people work hard on the big stuff and completely miss the repeatable little trigger that is nudging their readings higher several times every week. Those small repeated nudges can add up. The ninth category is sodium-heavy over-the-counter medicines, including some antacids and effervescent formulations. This one is incredibly overlooked. People pay attention to the sodium in soup, chips, and restaurant food, but they almost never think about the sodium in the medicine itself. Some tablets that dissolve in water, some antacid products, and some symptom relief formulations can contain a surprising sodium load. And for someone who is salt sensitive, that matters. If your blood pressure tends to rise when your sodium intake rises, then getting a hidden dose from medications can quietly work against everything else you're trying to do. So what should you actually do if you think one of your medications may be raising your blood pressure? First, Don't make a snap decision. Start gathering clean information. Check your blood pressure at home in a consistent way. Same cuff, same arm, same general times of day, seated quietly, and record the numbers. Next to that, write down the medication exposures. Include over-the-counter products, cold medicines, pain medicines, supplements, energy products, and as-needed drugs, not just prescriptions. This is where people often discover the pattern. The occasional medication they thought was irrelevant turns out to be showing up almost every day. Second, bring that list to your doctor or pharmacist and ask a very direct question. Could any of these be raising my blood pressure or making it harder to control? That is a fantastic question, and it is much more useful than just saying, my pressure is high. The more specific and organized you are, the easier it is for the clinician to help you. If there is a likely culprit, the solution might be changing to a different product, using the lowest effective dose, shortening the duration, adjusting the blood pressure regimen, or monitoring more closely while the temporary medication is being used. Third, pay attention to hidden ingredients. This is especially true with combination products. A cold medicine may contain a decongestant. A headache medication may contain caffeine. A dissolving medication may contain sodium. A supplement may contain a stimulant. The front of the box is often marketing. The back of the box is where the truth lives. And if you already have high blood pressure, those details are not trivia. They are part of your treatment plan. The more medication sensitive your blood pressure is, the more valuable label reading becomes as a form of self-protection. And finally, know when the situation is urgent. If your blood pressure is extremely high, or if you have symptoms like chest pain, severe shortness of breath, weakness on one side, trouble speaking, severe headache that feels unusual, or vision changes, that is not a watch and wait situation. That needs prompt medical attention. Most medication-related blood pressure increases are not emergencies, but some can be serious, especially when they occur on top of existing hypertension or other cardiovascular disease. It is always better to over-respect blood pressure danger signs than to shrug them off because you assume it's just stress or just a medication side effect. The encouraging part in all of this is that medication-related high blood pressure is often fixable. Not always instantly, and not always with one simple change, but fixable. And that matters because it means a rising blood pressure number is not always a sign that your body is simply failing or that aging is just taking over. Sometimes it is your body responding in a very logical way to what you're putting into it. Once you identify that, you can usually make much smarter decisions. That might mean a substitute, it might mean better monitoring, it might mean a totally different treatment balance than the one you started with. So if you take one thing away from this video, let it be this. When blood pressure changes, always review the medication list before assuming the change came out of nowhere. Review prescription drugs, review over-the-counter drugs, review the only as needed stuff, review supplements, powders, cold products, antacids, and pain relievers. The answer is not always there, but it is there often enough that it should become a habit. That simple habit can prevent months of frustration, unnecessary dose increases, and a lot of confusion about what your body is trying to tell you. I hope this was helpful. And if you've been struggling with blood pressure that suddenly became harder to control, this is exactly the kind of thing worth discussing with your doctor this week. Stay observant, stay organized, and stay curious about your own patterns, because that is often where the most useful answers are hiding. Thanks for being here.